Well, the virus may have been circulating around the United States much earlier than previously known, according to new modeling. Health reporter Stephanie Stahl is here with details on what's being called the hidden explosion. Steph?
Yuki, could you have had it? That's what many are wondering. People who were sick in February, many with that lingering cough, could that have been COVID-19? The answer is yes, according to this new modeling. COVID-19 was spreading undetected at least a month before cases were confirmed, according to new modeling from Northeastern University that's being reported by the New York Times.
We had community transmission, probably to a significant degree, far earlier than we had known.
The new reporting says on March 1st, when there were just 23 confirmed cases in the United States, there were actually thousands. And going back to early February, when the focus was on China, the virus was spreading in places like New York City, Boston, and Chicago, and seeding infections around the country. The report says the virus moved under the radar swiftly because adequate surveillance was not in place.
That's a very interesting hypothesis, that there were many cases before the first diagnosed cases were apparent, and so we'd be pleased to look at that and analyze it.
Other doctors and scientists give more credit to the new model, but like all models, it's an estimate, and this one includes people who experienced mild or no symptoms. So how do you know if you've been infected? Antibody testing. But there are accuracy concerns. Also, if antibodies are detected, do they provide immunity? If so, for how long? As Dr. Levine points out, the common cold is a type of coronavirus and people catch colds frequently.
The utility of the antibody testing is not clear yet, and we're going to be doing further investigations on that.
And officials say accurate antibody testing and a decrease in positive cases will help determine when it is safe to lift restrictions to begin restarting the economy. Yuki?
Steph, keep us updated. Thank you. Well, it's about